Thank you, Mr. Chairman, and thank you again for holding this important and critical hearing. I've found that whenever you doubt what's going on in America and you look at its future, travel to one of our schools. Last week I happened to go to Glastonbury High School in Connecticut in my district, and I ran into three extraordinary students who won the app challenge. Raul, Natish, and Jude, exceptional students, developed an app, and they chose for their theme mentality because they recognized that amongst their own peers, they were experiencing extraordinary stress because of the pandemic and also because of a lot of the concern that so many on this committee have already elaborated on with respect to fentanyl and the opioid crisis as well. It says a lot when you have high school students who recognize mental health and the epidemic and feel that there's a need for them to act. And they created an app, and I would like to enter for the record, Mr. Chairman, their application for the app challenge, because I think people will find this information incredible. St. Francis Hospital in Hartford, in conferring with them, said that there are as many as 200 adults and over 90 children seeking care for behavioral health just in emergency rooms in Connecticut. That's pretty remarkable. We need to act to address this crisis now. I have spoken to the Connecticut's Children's Hospital, which has really emphasized what we need to address with regard to mental health care for children is strong families, which help support the emotional health of kids. Like we did in this committee with the passage of the child tax credit, something spearheaded by our own Rosa DeLauro and Susan Delbene on this committee, and Mr. Chairman, with your leadership. Dr. Powell, in your testimony, you sounded the alarm on child health care crisis that our youth are facing. How does the childhood poverty and all of its implications compound mental health issues and the ability to get treatment, in your estimation?
Thank you for the question, Congressman. I think we have to recognize first that poverty does instigate poor mental health outcomes, but perhaps not by the pathways that we assume. One, children who live in impoverished communities are not hardwired for poor mental health outcomes. Rather, those children interface with systems and structures that fail to rise up to meet them at their highest intentions for radical healing. What our children in poverty often face are barriers in access to treatment and the availability of high quality care. They're often also forced with dealing with a mental health system that's fragmented and also extraordinarily high cost for those who may be or underinsured. And so if we were going to address the issues that many children who live in disadvantaged communities face, then we have to fix the structures and systems around them. And I know we keep saying this, but it is really important for us to underscore that no child deserves to be left behind in this way. In my opinion, there are many opportunities for us to facilitate better child mental health outcomes. And the first is one that we've already been discussing, and that is meeting children where they are, speaking to them and with them as opposed to over them. Children and youth have tremendous potential to contribute to our innovations, particularly in the digital health landscape, where we're seeing the sort of onboarding and emergence of new and effective digital mental health tools. Our children have tremendous opportunity to also help us reimagine the very systems that we say are supposed to serve them. In addition, we have to think about the settings where children are most likely to interface with mental health professionals and caring adults. As we've been discussing, schools are important, places and spaces for delivering mental health care, and yet those systems and spaces are woefully understaffed with appropriate care. We have to think about how do we use the staff that we already have available to us, because teachers are incredibly overburdened. We cannot train our way out of this crisis. Particularly, we can't teacher train our way out of this crisis. What about reimagining the roles of school resource officers, scrutinized in this era of discussions about the involvement of law enforcement? What if we provided them with more tools to provide mental health first aid? In the work that I do in countries outside the US, particularly in Kigali, Rwanda, where they have 2 psychiatrists, I think, in the entire country, they are utilizing the bandwidth and the ingenuity of lay health providers to support them in bridging and minding the gap. And we have to do that also. We have tremendous opportunity by deploying our community health workers, figuring out how to align payment and reimbursement systems to pay them and incentivize them, and integrating them fully into the mental health delivery system. We can do that in schools as well. The bottom line is that we owe it to our children to wrap our arms around them, to speak cumulatively to the wounds, collectively to the cumulative wounds that they are metabolizing in this moment. That is our duty, and that is what we must do if we're going to prepare our nation to compete globally in the future.
Thank you. I yield back.